Thanks for being here, Calley. It's been a busy couple months for you.
I've been meditating today.
Yeah, good.
No fights with the audience today.
So I want to start, I'm going to jump right in because we have so much to get through. President Trump created the Make America Healthy Again Commission, and it's scheduled to release its report really soon, by the end of the month, on causes of poor child health and potential solutions. What can we expect to see from that report? Give us a preview.
I think there's a little bit of misinformation or misunderstanding of this. I really think this report and what the administration is trying to do is something everybody should be supportive of. So when Secretary Kinney was sworn in, President Trump signed an executive order. It said, I want an assessment of why kids are getting sick in 100 days. Not the full scientific data on everything or the consensus view, because we don't have it, but an analysis of where the government should look at of why kids are getting sick. And then 80 days from that, 80 days from May 22nd, when this initial report's released, some policy ideas. So the report coming out is going to be the strongest statement in the history of the US government that 95% of healthcare spending is chronic disease. And chronic disease is not an issue of needing to spend more on healthcare. We spend 4 times more than most European countries per capita on healthcare. We're living 7 years less than the Italians. As we sit here today, I just calculated, as we sit here today, 3,254 teens will get prediabetes. 38% of US teens have prediabetes. So what the report's going to go into, very deliberately, not policy. It's the factors of what's leading to this devastating chronic disease crisis. And that clearly has to do with the fact that 70% of a child's diet today is ultra-processed food. 0% of the diet was that 100 years ago. Clearly it has to do with the fact that we're so sedentary that 77% of military-aged youth in America aren't eligible to join the military, that an average teen spends 8 hours a day looking at a phone. Clearly it has to do with environmental toxins. It has to do with that in America, we are ingesting 25% of the world's pesticides with 4% of the world's population. The fact that our leading pesticides that we use in the United States and herbicides, many of them are phased out or fully banned in every other developed country in the world. And yes, absolutely has to do with over-medicalization. Is the fact that 25% of US women, the fact that they're on an antidepressant of some kind, is that leading to lower suicide rates and better mental health? Is the fact that 18% of teens being on a stimulant leading to better outcomes in children? Is the fact that 35% of teens are on a pharmaceutical product making them more healthy? The assessment just gives the facts, and I do think it is an important time in American history with skyrocketing rates of chronic disease, particularly among kids, to assess that and have an adult bipartisan conversation about how to reverse these trends. That is what the report is going to do. And it's interesting, I'll just say this. There's relentless lobbying, not about the policy, but about releasing the truth that everyone knows. I cannot tell you how many lobbyists tell us, you're going to scare the American people. You're going to confuse moms. You can't do this to consumers. People that have been on this stage, their lobbyists are saying that. There's an infantilization of the American public that's shocking to see, and there's a war on the American public having transparency. And this administration, I'm very inspired by it. There's very complicated policy issues to discuss on ultra-processed food, on pesticides, on medicalization, but they are not going to take lobbyist input on releasing the truth to the American people.
You mentioned pesticides. It doesn't seem like there's consensus across the entire Trump administration on where to go with that. What are you hearing?
President Trump said throughout the campaign specifically that he wants to look at pesticides and he wants the truth on pesticides. Now, the policy, again, this report is on the truth. It's on the dynamics. It is a fact that we ingest 25% of the world's pesticides in the United States, and many of our leading pesticides had other countries across the world have chosen to phase them out or ban them, calling them carcinogenic and disruptive to kids. Those are the facts. Those are easily Googleable. The United States government has never recognized those facts. When you get to policy, and I want to make this clear, I don't think anyone in the Trump administration, and I don't think it's the right policy to say that insinuates that we need to have some kind of European anti-growth regulatory nanny state. Like this is the party, and I believe I'm in the party of Elon Musk, who saw an environmental catastrophe that everyone on the left was complaining about for years and years and years, and has become the greatest environmentalist in the history of modern civilization, that now the left attacks 100% by driving free market innovation with Tesla. People are snickering. I've meditated. I'm not getting in fights with the audience today. I'm not doing it. Please. Okay, so
Deep breath.
so that, so I just want to say, to the lobbyists that are, pestering people in the administration, pestering Congress to not print easily searchable facts that nobody disagrees on, that's not going to work. But the policy solutions from this are not obvious. Pesticides are deeply ingrained into the U.S. agriculture system, and it would be a disaster to phase them out tomorrow. Nobody's suggesting that. What we do need to have, with, I believe, almost genocidal levels of children's chronic disease right now, we do need to have a very careful conversation about what world we are building for the next 10 years. Mm-hmm. And we're not going to take lobbying advice on releasing facts.
Yeah. I want to switch gears a little bit to another topic that's in the news today, Medicaid. How important is Medicaid, in your opinion, in general as a program, and specifically to hospitals and people in rural locations?
I mean, it's extremely important for people to have health care, but I think the Democrats are on a completely losing message that the only thing standing between the United States citizens and better health care is more spending and more bureaucracy, which is explicitly what their argument is. Their explicit argument is that Medicaid is great and we just need to have more of it. I think what the Trump administration is doing clearly is exercising the voter mandate that was very clear in this administration, election, is that the healthcare system is a dumpster fire. It's totally broken. We are the sickest country in the world. We have the sickest kids in the world, and we spend 3 to 4 times more than any other country in the world on healthcare costs. So with Medicaid, it's been very clear benefits aren't being cut. But I'll tell you, and this, I'm on the MAHA stuff, and I've been working with colleagues at the White House who are experts at Medicare and Medicaid policy. The waste, fraud, and abuse is breathtaking and shocking. And I think the Trump administration's point that we are going bankrupt from healthcare costs and getting sicker at the same time, and we in these in the budget proposals are going to take a sledgehammer to waste, fraud, and abuse, which clearly exists, I think is what the American people want.
Yeah. So the proposals that that the House of Representatives is marking up, I think, right now, there are varying estimates of how many people would lose coverage as a result, but it's safe to say that it would be in the millions. So are you saying that they're all...
Oh, no, that's misinformation. That's total misinformation. No, it's very clear. Some illegal immigrants will lose coverage. California is breaking their neck to try to protect illegal coverage for illegal immigrants. I mean, they're outwardly trying to break the law as it exists right now to do that. People that absolutely demonstrably refuse and have no interest in working when they're able-bodied under the proposal would have Medicaid phased out. And I think that's about an 80% issue of people that agree with that. So I think that's totally incorrect. People that should not be getting Medicaid would be phased out of the program, but you had that number. Who that eligible for Medicaid or isn't not working when they could be working and not even actively looking for jobs, and we don't even know if they have another job on the table. What are you referring to?
Well, there's some numbers, I think KFF perhaps, I think is the source, that about 2/3 of people that are on Medicaid actively work. So I think... Right,
so that's 1/3 are not actively looking for jobs or working whatsoever, and many of them, according to reports, have jobs out of the table. I've meditated. I'm not doing it. I'm not doing it.
Okay, thank you. So let's switch gears again.
Yeah, there's nobody. That is complete misinformation. So the proposal is clear.
So I want to talk about trust.
Yeah.
It's well known that there's a crisis of trust in the country's public health agencies. That's something you've been very vocal about wanting to fix. What do you think laying off thousands of healthcare policy administrators and then hiring some back, what does that do to trust?
Oh, I don't know if you've ever run a business, but when you're dealing with the literal largest department in the history of human civilization, which is HHS, it has the largest budget of any department of government in the world, and it regulates and oversees and is integrated with the largest part of the US economy, and you have a voter mandate to reform that institution, which is hopelessly broken and producing worse outcomes with higher costs. The correct thing to do is move decisively to do that, and I can't imagine any world where some course corrections need to be made. So the fact that the media, I think it's shameful. I honestly think it's shameful. You should be talking about the 38% of teens who have prediabetes, who are getting crushed in this country. But you are talking, not you, maybe, but many reporters, it's just an open sieve to career officials at the FDA giving you anecdotes. Oh, this program was cut, this person was cut who's sympathetic, this program that sounded good was cut. That's a choice. That's not reporting the story. The story is that Bobby Kennedy has a spiritual mandate, I believe, a mandate from voters to reform our broken institution. To reform the broken institution, take a sledgehammer, sorry, I'm gonna do it, take a sledgehammer to the people in this audience who are laughing, who profit from a system where kids are sick. Everyone who works in major healthcare industries may be good people, I don't know, but they are fundamentally, as an economic fact, are profiting more when people are sicker for longer periods of time. What Bobby Kennedy was given a mandate to do is we are not going to be tolerant of companies that profit from kids being sick. I commend the person before. I commend him for, I mean, his only mistake was not complimenting Bobby Kennedy and complimenting him and giving him credit for the fact that they're being forced to take poisons out of their food. I think he's incorrect saying that the way to grow muscle is take bioengineered food instead of lifting a weight. But the fact that there's this cultural change is because of Bobby Kennedy. The idea that you look at the NIH, with the assessment of the CIA, the Energy Department, and 5 other major government bodies, that the CIA funded the creation of a global pandemic that cost $25 trillion. That's the NIH's record. The NIH funded the creation of the global pandemic. They have not done one study that Jay Bhattacharya could find. Can you find one example, can you report one example in the past 5 years of the NIH funding research that has led to their mission of a demonstrable impact on longevity or an improvement of chronic disease? The idea that these agencies overseeing the record of healthcare in America right now should not be fundamentally reformed, that the employee levels shouldn't be taken back to levels they were 7 years ago. It's absurd. It's absurd.
So do you think that firing all these workers and then not being clear, there are about 10,000
70,000 workers at the HHS.
10,000 workers that were fired.
All these workers, that's an interesting statement.
Do you think that firing all of them, all 10,000 of those people, and then hiring some back and not being clear about exactly who's being hired back and when, I'm just curious.
I think it is a scandal that you are talking to and the media is just on the phone with career employees finding anecdotes and not talking about these civilizational efforts this administration is undertaking to reverse chronic disease. And I think that the snickers in the audience, you guys have zero leverage with the American people. Like you have zero leverage with the American people. The American people, and I have a message for the pharma people in the audience, the American people have a crisis of trust in your industry. They have a crisis of trust. No, the American people have a crisis in trust in healthcare institutions because the medical system and medical leaders absolutely bold-faced lied to them during the COVID pandemic because drug prices for many leading drugs are 10 times higher than they are in Germany and Sweden for drugs that are made in America and have the exact same packaging or the exact same drugs.
Okay.
Because, that is the mandate. That is why Secretary Kennedy is the most popular cabinet secretary in the country. That is why Bobby Kennedy is the second most popular, he's the second most popular political figure in America behind President Trump. Oh, really? They're a Democrat?
Well, let's talk a little bit more
I don't
about
want to, this misinformation here is very concerning, honestly. They're saying there's a Democrat that's more popular than Bobby Kennedy or President Trump. I'd like to see that.
Let's talk about the interactions between MAHA and MAGA. In the past couple days, there have been some high-profile, disagreements between you and some other figures in these spaces on X. Take us behind that tension. What is that fundamental tension there?
I think that this is a coalition that is one of the most important realignments of American politics in the past 100 years. You had the gender gap close dramatically. You had moms that considered themselves hippie that would have never considered voting for President Trump, vote for President Trump. You had young people vote 50-50 for President Trump. You had independents vote 50-50. So this idea of tapping into this deep pain and deep anger people feel for the childhood chronic disease crisis is a new arrangement in politics. I mean, just flatly, there's a medical freedom community that I very much sympathize with and agree with on almost everything, that we have to give patients more control and autonomy over their medical freedom. And there's a lot of conspiracies and a lot of chatter on Twitter. We don't, can litigate as much as you want, but I think it represents to me that there is high stakes. And I think it's actually one of the powers of the movement that a lot of people really care and are holding people accountable.
We're out of time. One more question, yes or no. Can MAHA and MAGA coexist?
Oh, President Trump and Secretary Kennedy are in total lockstep. I'll just say this, like from the heart, I am blown away by how much President Trump understands this issue and is empowering Secretary Kennedy to take transformational action to reform our institutions, to install gold star science, and reverse the childhood chronic disease crisis. I am inspired by the deep conversations that Secretary Kennedy is having with Lee Zeldin at the EPA, Brooke Rollins at the USDA. The administration is in total lockstep. There's always going to be mid-level staffers leaking. We're trying to disrupt the people in this audience who profit from kids being sick, and they will be hiring lobbyists to set up war rooms against my sister, to sow division, whatever. But at the highest level, despite the media narrative that's inevitable when you're disrupting the largest institution in the country, that there's division, there is lockstep alignment of pro-growth policies to take a sledgehammer to these devastating health outcomes that I said I wouldn't do, but it's just amazing. It's just amazing. This audience is snickering at the fact that we have the sickest kids in the world. It's shameful.
It's time to wrap up, but thank you so much. We could talk about it. There's a lot more we could touch on, but thank you, Calley.